is a herniated disc? Maybe a doctor, a physiotherapist or practitioner suspected you've got a herniated disc, or you've read a scan report which says so. What do you need to do about it? Well, we'll try and answer all of those questions in this video. I'm Anthony Gosh, the lead neurosurgeon at the Spine MDT. Please click the subscribe button so you can be up to speed with weekly videos we post about back and spine care. You can also click the link below to visit the website and the blog page, where we also post the videos as well as blog articles related to problems with the spine and ways you can maintain a healthy spine. So what is a slipped disc? Well, firstly, before we answer that question, why don't we have a look at the anatomy of the spine to help us understand it a bit better. So here's the human spine here. It's made up of a stack of bones called vertebrae. Each vertebrae is a block of bone with an arch of bone attached to the back. So this is the front, that's the back, and each bone, each vertebrae is separated by these cushions here that we call discs. This is another view looking at the spine from underneath. If we slice someone across the waist or across the torso and look at them from underneath, that's the back, that's the front. This is the disc area between the two bones, and this is the arch of bone at the back. And that arch of bone, once you stack them on top of each other, creates a tunnel through which the spinal cord runs. That's in the upper bit of the spine and down to the lower thoracic spine and just entering the lumbar spine, and then lower down are all the nerve roots. Between each bone, a nerve leaves the spine. Now in the lumbar region, the lower back region, these lumbar nerves innervate different muscles, mostly in our lower limbs, in the buttock, thighs, calves, and also give sensation to the skin in that region. The discs that we see between the bones, these are essentially shock absorbers. They're cushions, they're shock absorbers. So a disc is made up of a material called a nucleus and a surrounded annulus around it. So kind of think of it a bit like the egg, the yolk of an egg, and then the surrounding fluid, if you like, or softer tissue. When we're young and healthy, we maintain a very healthy looking yolk and a very well hydrated disc, which has got lots of water content inside it. As we get older and we adopt bad habits, bad postures, you start to notice wear and tear in the spine, and this predominantly happens lower down at the bottom of the column in the spine, which is subject to more stresses from axial loading from the weight, as it's at the bottom of the column. The lining starts to tear, the spine loses its water content. So this is where you get the term dehydrated disc or degenerated disc. It can tear, and then sometimes a bit of this material, the actual yolk of the disc, migrates outside of the lining of the disc. This can happen in different forms. It can sometimes be what we call an extrusion, where a fragment of it completely breaks off and ends up loose inside this space here in the canal, pinching the nerves that go to the leg, and that can give you pain radiating down the leg. Sometimes it's a very small bulge that might touch the nerve or be close to the nerve but doesn't cause any compression of it. So disc herniations are very common, and they're quite often seen in patients who don't actually have any symptoms, just randomly seen on an MRI scan. So the question about what you need to do about it or when to treat it often depends on the types of symptoms you have. At the time of the tear of that lining of the spine, a bit of fluid initially leaks out, which is quite inflammatory, stings some of the surrounding tissues and nerves, can cause a really acute bout of severe back pain, sometimes leg pain. Usually as that stuff washes away, as your body clears that away, the pain and the symptoms settle down. Now in our lifetime, it's quite common for the lining of the disc to tear at some point and the fluid to leak out. This commonly happens in late 30s to mid to late 40s, and it's quite common to see dark dehydrated discs chronically, because they will end up looking that way indefinitely. Now that's not necessarily a bad thing. People live with that without any symptoms or any pain. When it starts to become a bit more of a concern is when the actual inner material, that yolk that we talked about, the nucleus, when a lot of that material comes out and starts compressing a nerve, that's when it can cause sciatica, pain down the leg, and that's when sometimes treatment may be required. And the reason I say sometimes is that in the majority of patients, the symptoms do actually settle down within a few weeks. Your body starts to break down some of that disc material, pinching the nerve, the pressure is released, the pain slowly settles down, and all that inflammatory fluid just gets washed away and reabsorbed. The scenarios where there's urgency to do something is if this disc is huge and slips more centrally, compressing all of the nerves in the middle of the canal, the nerves that go down to your bladder, your sphincters, and then you start getting weakness in the legs, numbness in the saddle region, difficulty passing urine. That becomes an emergency. That disc needs to be removed quickly to decompress the nerves, to protect them so that you can still maintain function of continence, i.e. Function of your bladder, your bowel, and also not to lose power in your legs. Usually if it's just pinching a single nerve and you've got pain shooting down the leg, it will settle down. Sometimes that will need an operation or an injection around the nerve if it's not settling down in that time. However, in the early days, if you're noticing progressive weakness in one of your legs from that, then that does need an urgent scan and urgent decompression to try and preserve the function of that nerve and the power in your leg. The operation described is in this blog here. There's a link below as well as to the video. It's called a microdiscectomy. Neurosurgeons tend to carry out this operation under a microscope. That way we can use much smaller wounds for a minimally invasive technique where everything's magnified, and we go in and remove that bit of herniated disc to free up the nerve. Herniated discs aren't only seen in the lumbar spine, but they're also commonly seen in the cervical spine, in the neck region. That's because these are the two quite mobile segments of your spine. Occasionally you can see it in the thoracic spine. That's the section of your spine that's protected or housed, surrounded by your rib cage. That tends to be less mobile, so it's quite rare, but you do see it from time to time. Now, in the cervical and the thoracic spine, when you have a slipped disc or herniated disc, one of the concerns is that there's pressure on the spinal cord, which you don't get in the lower lumbar spine. And that can cause progressive weakness in the arms and legs. A lateral disc, a disc that's a little bit more sideways, shall we say, in the cervical spine, gives you the kind of sciatica of the arm, i.e. pain radiating down the arm with weakness. And again, the same sort of things apply. Sometimes you need surgery if things are not settling down, or if you're getting progressive weakness that needs an urgent operation. I've done a blog on anterior cervical discectomy here, where you go in through the front of the neck and remove that bit of disc to free up the spinal cord or the nerves. But again, in the majority of patients, after that acute insult, if it's just pain, things usually just... Depending on where the disc lies, there are, and your symptoms, of course, provided you don't have any progressive weakness or any weakness related to the nerve, and depending on where it lies, there are certain manipulations or adjustments an osteopath or a chiropractor can do, and some physiotherapists, that can help just release that disc a little bit off the nerve and give you some alleviation. You've got to be very careful in doing these techniques. It's very important the person doing it is experienced and understand some of the symptoms you have beforehand to make sure you don't have any actual neurological deficits, because aggressive manipulations of either the neck or the lumbar spine in the context of a slipped disc can sometimes make things worse. And that's why it's very important to get a proper assessment from a practitioner who knows what they're doing. Now, if you have chronic back pain without leg pain, and a scan has mentioned or been reported to show degenerative discs or disc herniations that are not compressing any nerves, it's important not to dive into the assumption, for any practitioner, not to dive into the assumption that that is the cause of your back pain. It's very difficult to deduce that. The spine's quite a complex anatomical structure. It's made up of multiple bones, ligaments, joints, muscles attached to them, and any of these things can cause pain. Most of the time, in fact, it's the surrounding muscles of the spine, and to some degree the joints. From weakness of those muscles, bad posture, the strain in the joints can trigger secondary muscular strain. And that's where things like physiotherapy to building your core, so core strengthening programs, come in handy. I hope this video has answered most of your questions, or you found it helpful. Please feel free to get in touch with us through the website or the email address below, or call us to ask any questions. Hopefully we can help you. As mentioned before, please subscribe to the channel. I post weekly videos to try and help people understand the spine and back care a lot better. Our goal at the Spine MDT is to find the least invasive solution that gives you the longest lasting result, and we're able to do that by working together as a team of surgeons, physiotherapists, osteopaths, chiropractors and pain specialists to achieve that goal. Please get in touch with us, we'll be very happy to help you.